Imagine this. You're alone and it starts. It could be late at night. Everything seems normal until suddenly a strange pain appears in your chest. At first, it feels like just a minor discomfort. Maybe you're just tired. But then the pain intensifies. Your heart starts racing, a cold sweat drips down your skin. You feel short of breath, a tightness in your chest spreading to your arm, neck, and back. And then it hits you. You're having a heart attack. But now what? Do you know how to act fast to save your own life when you're alone? A heart attack, or acute myocardial infarction, is one of the leading causes of death worldwide. In the US, someone suffers a heart attack every 40 seconds. Many of them don't survive simply because they didn't take the right steps in time. In this video, I'm going to teach you 5 life-saving actions that can help you survive a heart attack, especially if you're alone. We'll bust common myths, explain what actually works, and prepare you to take the right steps when every second counts. But before we get into it, make sure to like this video and share this vital information with your friends and family. You could help save lives. And tell me in the comments, have you ever had a heart attack? Or do you know someone who has? Where in the US or the world are you watching from? Let me know below. Now, listen carefully, because what you do in the first few minutes could determine whether you live or not. 1. Recognize the signs and symptoms immediately. If you notice something unusual happening in your body, pay attention. A heart attack doesn't always start with that sudden, crushing chest pain you see in movies. In fact, many heart attacks begin subtly, with mild symptoms that gradually worsen over minutes or even hours. The biggest mistake people make? Ignoring the signs, thinking it's just fatigue, indigestion, or stress. That could be a fatal error. The classic symptom is an intense pressure or pain in the center of the chest. Many people describe it as a heavy weight pressing down, almost like an elephant sitting on their chest. This pain can last for several minutes, disappear, and then return even stronger. If this happens, it's a major red flag, but it doesn't stop there. A heart attack can also cause pain in other parts of the body. You might feel discomfort radiating to your left arm, neck, jaw, back, or even your stomach. Some people experience heaviness in the shoulders or an unexplained numbness in their arms. This happens because the heart and these areas share the same nerve connections, so your brain might misinterpret the pain. Warning: be aware of atypical symptoms. Not every heart attack follows the classic pattern. Women, the elderly, and diabetics may experience different symptoms, sometimes without any chest pain at all. For women, the most common signs can include extreme fatigue, nausea, back pain, and shortness of breath, often mistaken for digestive issues or anxiety. Diabetics may even experience silent heart attacks, where symptoms are so mild they go unnoticed. Another critical warning sign is excessive, unexplained sweating. If you suddenly start sweating profusely and feel cold and clammy, even while at rest, take it seriously. This kind of cold, sticky sweat is a strong indicator that your heart is under extreme stress. Shortness of breath can also be one of the first warning signs. When the heart isn't pumping efficiently, fluid can build up in the lungs, making it hard to breathe. Many people describe a choking sensation or feel like they can't take a deep breath, even without exertion. Feeling dizzy, lightheaded, or suddenly exhausted for no reason. Pay close attention. A heart attack can drop blood pressure or cause arrhythmias, leading to sudden weakness or the sensation that you might faint. Many survivors report a strange sense of unease, like something is terribly wrong, but they can't pinpoint what. Another critical symptom is extreme anxiety or a sudden feeling of impending doom. Many heart attack victims report that just before the event, they felt an overwhelming sense of fear, as if something terrible was about to happen. This could be due to a surge of adrenaline released by the body when the heart is in distress. Experiencing nausea or vomiting without an obvious cause. This can also be a warning sign, especially in women. Many heart attacks trigger gastrointestinal symptoms, which are often mistaken for food poisoning or acid reflux. Now, here's the golden rule. If you experience any of these symptoms, especially in combination, do not ignore them. Time is critical. The faster you act, the higher your chances of survival. Many people lose their lives simply because they wait for the symptoms to go away, assuming it's nothing serious. Don't make that mistake. If you're having a heart attack, recognizing the warning signs early could be what saves your life. Now that you know what to look for, stay alert and never ignore what your body is trying to tell you. 2. Call emergency services, but do it the right way. The first step to saving your life is to get help immediately. In the United States, dial 911. If you live in another country, make sure you have your emergency number saved on your phone. If possible, call a neighbor or a nearby family member for help before your condition worsens. But here's a crucial warning. Do not try to drive yourself to the hospital. Driving during a heart attack can be fatal. Your heart could go into a dangerous arrhythmia, causing you to lose consciousness while driving. This not only puts your life at risk, but also endangers everyone else on the road. If an ambulance takes longer than 15 minutes to arrive, you need to act fast. Ideally, medical treatment should start within 30 to 60 minutes of symptom onset. This is known as the golden hour, where survival chances are significantly higher. If, after calling emergency services, you realize the wait time is longer than 15 minutes, don't hesitate. Call a taxi, Uber, or ask a neighbor to drive you to the hospital immediately. The faster you receive professional medical care, the better the outcome. But remember, under no circumstances should you drive yourself. At any moment, your blood pressure could drop, your heart could enter a life-threatening rhythm, and you could pass out behind the wheel. Don't take that risk. To increase your chances of survival while waiting for help, unlock your door and, if possible, sit or lie down in a comfortable position. If you have pets, place them in another room to avoid confusion when paramedics arrive. Every second counts. Make the call, stay calm, and get help as quickly as possible. 3. Chew an aspirin immediately. If you have aspirin at home and are not allergic, take one 325 milligrams tablet right away. But pay attention. Don't swallow it whole. Instead, chew it thoroughly before swallowing. This allows the medication to enter your bloodstream faster and start working immediately. Now, you might be wondering, why chew it instead of just swallowing? Imagine you need to put out a fire quickly. If you pour water directly onto the flames, the fire dies down faster. But if you pour water slowly, it takes much longer to extinguish. That's exactly how aspirin works. If you swallow the pill whole, it has to go through your stomach, dissolve, and only then be absorbed into your bloodstream. This takes valuable time you don't have during a heart attack. Why does aspirin help? A heart attack happens when a coronary artery gets blocked, like a clogged pipe, preventing blood from reaching the heart. Aspirin acts like a temporary unclogger, preventing the clot from growing larger and allowing some blood to keep flowing. This reduces the severity of the heart attack until doctors can fully clear the blockage at the hospital. What's the right dose? The recommended dose is 325 milligrams of aspirin. If you only have 81 milligrams baby aspirin, take 4 tablets to reach the full 325 milligrams dose. But if you have a full-strength 325 milligrams aspirin tablet, just one pill is enough. When not to take aspirin, if you already take blood thinners or have a bleeding disorder. If your doctor has told you to avoid aspirin due to a medical condition. If you're unsure, wait for emergency medical professionals before taking it. Another important warning: do not take vasodilators like Iserdil or Sustrate unless a doctor has specifically prescribed them. In some types of heart attacks, these medications can dangerously drop blood pressure, making the situation even worse. Remember, aspirin won't stop a heart attack on its own. It buys you precious time until medical professionals can fully treat the blockage. That's why calling 911 and following the other life-saving steps is crucial. 4. Stay calm and conserve energy. I know it's hard to stay calm in such a critical moment, but panicking will only make things worse. A heart attack is already putting immense stress on your heart. The more anxious or agitated you get, the faster your heart beats, increasing the risk of complications. Try to control your breathing. Inhale deeply through your nose and exhale slowly through your mouth. This can help reduce strain on your heart and keep circulation stable. Avoid any physical exertion. Do not try to walk, lift anything, or move around unnecessarily. Sit down with your back supported or lie down in a slightly reclined position to help blood flow more efficiently. If you feel dizzy or weak, lie on your side to prevent falls or injury. 5. Avoid myths and misinformation. Have you heard that coughing hard can help during a heart attack? That's a myth. The so-called cough CPR doesn't work and can even make things worse. Repeatedly coughing will not clear a blocked artery, because the real issue in a heart attack is not the heart's rhythm, but the obstruction of blood flow. Another dangerous mistake is self-medicating without medical guidance. Some people think drinking energy drinks, strong coffee, or large amounts of water might help. But these won't do anything, and in some cases, can make things worse. If you're having a heart attack, follow the correct steps and wait for medical professionals. Don't waste time on ineffective tricks. Prevention tips: how to avoid a heart attack before it happens. The best way to survive a heart attack is to prevent it from happening in the first place. Making a few lifestyle changes can literally save your life. Eat a heart-healthy diet. Reduce your intake of sugar, unhealthy fats, and ultra-processed foods. Instead, focus on eating more fruits, vegetables, and healthy fats like those found in avocados, nuts, and olive oil. Stay physically active. At least 30 minutes of daily walking can help strengthen your heart and improve circulation. Manage stress. Chronic stress is a major trigger for heart problems. Try meditation, deep breathing exercises, or simply taking time to relax and unwind. Avoid smoking and excessive alcohol. Smoking and heavy alcohol consumption drastically increase your risk of a heart attack. Cutting them out, or at least reducing them, can significantly protect your heart. Get regular health checkups. If you have high blood pressure, diabetes, or high cholesterol, monitor your health closely and follow your doctor's recommendations. In recent years, medical advancements have significantly reduced heart attack mortality rates worldwide. However, many people still lose their lives simply because they didn't recognize the warning signs or didn't seek help in time. Conclusion: now you know exactly how to act if you experience a heart attack while alone. This knowledge could save your life, or someone else's. But remember, if you notice any of these symptoms, do not ignore them. Call emergency services immediately and follow the right steps. And of course, if you suspect any health issues, don't wait, see a doctor. If you've noticed multiple warning signs, talk to a medical professional and follow their advice. Did you find this video helpful? Share it with your friends and family. This information could save lives. Now tell me, what's the next video you're going to watch? I've left some recommendations so you can keep learning.